all have them though, right? We're not going to have to fill 20 minutes or 15 minutes by ourselves. Okay. I mean, they have the links now. All right. Medical questions? Well, yeah, sorry. I was monitoring them. I think these came in a little too late. The broadcast journalism one is good. No. Yeah, no. I mean, not blaming, but... hey, folks, some really great questions here. I'm sorry I'm not able to get to them because we already wrapped up our conversation with Lynn Mahoney, but that is because we're setting up for our next segment, and it's a doctor's note with Dr. Alok Patel. But we certainly hope we'll get your questions answered next time. That is a good question about broadcast journalism. I appreciate that. It is hard to do that online. There is a way. You know, some of our reporters, a lot of our reporters are now practicing their craft, never coming to the station. It is not easy, but they are doing it. All right, we're coming back on air on ABC7 News.
9, 8, 7, 6, 5, 4, 3.
Welcome back. We're now able to bring you even more content now that we have this new platform at 3 o'clock every day. That means we get more from our special correspondent, Dr. Alok Patel. He's part of our coronavirus team of experts. Every day, he's going to talk directly to you in a segment we're calling Doctor's Note.
You've probably seen scary headlines about a rare, mysterious illness affecting children and how it might be linked to COVID-19. I'm Dr. Alok Patel. I'm going to give you an overview and tell you what you need to know on today's Doctor's Note. Doctors are calling this illness pediatric multisystem inflammatory syndrome. And based on how it's presenting, it's being compared to two other diseases, toxic shock syndrome and Kawasaki disease. Kawasaki disease is a rare illness that can cause inflammation in the arteries, including those around the heart. And it's a leading cause of acquired heart disease in children. Kids usually have a fever for several days, develop a rash, swollen neck glands, swelling of their hands and feet, cracked lips, and eye redness. Toxic shock syndrome causes a severe fever. Signs of shock, such as low blood pressure, high heart rate, can cause organ damage, and is associated with a toxin, such as one from a bacterial infection. This condition, pediatric multisystem inflammatory syndrome, is in its own category, but it has features of these other two diseases. Now, there are now about 100 documented cases across the United States, with the majority in New York, including a few recent deaths. Most of the hospitalized kids either tested positive for coronavirus or had a positive antibody test. Now, doctors are unsure why kids are being affected like this, but some suspect it may be due to a post-infectious immune response. Now, still, by and large, kids are doing well against COVID-19, but we can't assume that every case is going to be a mild one. We're just learning more and more as the days go on. And parents, don't panic. This sounds scary because it is, but remember, it's rare. Just be on the lookout. If your kids seem really sick, or if they have symptoms like a really high fever, abdominal pain, a racing heart rate, or changes in their skin color, call your doctor or get them seen by a medical professional.
Good advice from Dr. Alok Patel. We're going to take a short break on air, but the conversation continues on our live streams, including Facebook Live and ABC7 News app, and we'll come back with two local business owners ready to reopen.
In commercial break.
All right. Yeah. Okay. It's cool. Thank you. I was just about to do that, so thank you. Yeah, no problem. What are you calling this? Oh, Skype. I see. Okay.
Hey, John. This is David at KGO TV in San Francisco. Can you give me a thumbs up if you can hear me?
So is this 1 or 2 segments?
1 minute.
Hi, John. This is David at KGO
And what?
TV in San Francisco. Can you give me a thumbs up if you can hear me?
Okay.
John, I need you to turn your camera sideways to portrait mode, or to landscape mode, please. There we go. Thank you very much.
All right. Hey guys, we are busy setting up for our next on-air segment, talking to a couple of businesses because you probably heard that we are going to move into phase 2 in the Bay Area, 6-county Bay Area region on Monday. So let's see. Sent. That means a lot of questions. Let's see, Sabrina. Oh, okay. That's great.
Coming up here in 3, 2, 1.
Hi there, welcome back. San Francisco Mayor London Breed says 95% of San Francisco's retail businesses will be able to reopen for curbside pickup and delivery come Monday, May 18th. Shopping malls will remain closed. We have confirmed that San Mateo County will also be on board with this plan. We've reached out to the other 4 counties, Alameda, Contra Costa, Marin, and Santa Clara, to see if they're also part of this. We haven't heard back yet, but in the past, these 6 counties have moved in unison. So joining me to discuss what this means from a business and health perspective are our special correspondent, Dr. Alok Patel, and 2 San Mateo County business owners, Jim Bernardini, owner of Lefty Sports, and John Kavranian, owner of Nuts for Candy, both located in Burlingame. Thanks for joining me, gentlemen.
Thank you.
Jim and John, you've been closed for 2 months now. Are you so eager to open? I mean, are you ready to reopen Monday?
We are so excited that this county of San Mateo will be allowing us to open on Monday. We were open last Wednesday. We received a call. I called 211 San Mateo County hotline. They gave us permission to open because we have essential products, puzzles, and educational products. And I guess there was a misunderstanding. I received a text message from a Burlingame councilwoman saying that I'm not abiding by the law, that I have to close. So there was a conflict. A lot of people were confused with the governor's mandate and the county of San Mateo. So we closed on Monday, a couple of days ago. So we're excited to open this coming Monday.
Okay, well, that's great. And the confusion you just spoke of, I think there are others who have experienced that. So you do have to meet certain conditions and health safety plans in order to reopen. So if you can talk about how you're going to observe social distancing and also protect the health of both your customers and employees. What do you think, Jim? What's your plan there at Lefty's?
Well, you know, we've obviously been watching a lot of what's been going on in the news all over the country on what other stores and locations are trying to do. I want my customers to feel 100% safe, even if they're at my front door. You know, we have plexiglass covering there. We have all the correct cleaning supplies. When product does come into the store, we sanitize it first. And then if anybody does make a purchase, we'll sanitize it right then and there before they take it, before we hand it over to them. Same thing with, you know, with the use of their credit card and so on, you know, rubber gloves, masks, the whole 9 yards. I mean, I want to feel as comfortable walking up to my front door as I would going into somebody else's store or John's store. You know, I want to feel that I would assume he would do everything possible for my safety, just like I would for his.
Dr. Patel, what do you think? I mean, that sounds like a sound plan. What are the points of transmission, if you will, in a shopping experience?
Well, I think Jim and John are doing the right thing in kind of addressing how they're going to be able to keep not only their staff and everyone working with them safe, but also making customers feel comfortable, because there are so many points of transmission, not only with customers with each other, customers to employees, employees with one another as well, even the products going back and forth. And so that's why it's so important to make sure that we not only have.
All right. Gentlemen, if we could just talk one at a time, that'd be great, because I think our mics pick up all of you at the same time.
Can you guys not hear me?
I think our Zoom guests actually cannot hear you, so That's okay. I'll be the translator. But John, I want to know, you sell puzzles, right? Which is, of course, in high demand. I've been looking for them on Amazon, hard to find them. So I'm glad I'm going to be able to get it from your store curbside. But how will people shop for things like that if they can't come into the store and look? You know, let's say I want a Disney puzzle or maybe a puzzle of flowers. Do I just tell you? Are you guys, you know, someone at the curb and just ask me what I want? How does that work?
What we're doing with our puzzle inventory is we're taking pictures of every single puzzle we have, and we're posting it on our Nuts for Candy Facebook page. And people make a comment in the comment section if they're interested, and we will reserve it, and then they pick it up. And then when they come in, they pay by credit card. And we have a big order of puzzles coming this week. We're getting ready for Monday, hundreds and hundreds of puzzles that are arriving this week for us.
What about candy and nuts, especially the ones in bulk? Are you not doing bulk right now?
What we're doing is we wear gloves and we wear our mask and we bag the products ourselves. If a customer comes in and says, I want 1 pound of chocolate nonpareils, we bag it ourselves.
Gotcha. How about you, Jim? If we can see your store, I mean, I've been to Lefty's. You've got sports memorabilia, but also you have sports merchandising. You got hoodies and, you know, shorts. I don't know if you can kind of turn that around so people can see, but how will people try on clothes? I mean, they cannot. So how would people shop for clothes or even hats, right? Things that require sizing.
I think they'll shop for clothes the same way they would on Amazon. They'll ask for sizes. If we have the sizes that they want, we'll ship them out to them and or bring it out to them. Obviously we can't have anybody in the store to try on clothing or anything. But for the most part, our product is pretty much trading cards. That's most of what it is now. And we can put a couple whiteboards out in front of the store and say, here's the new product that we have that just came in this week or today. And customers can make orders based on what they see there. We have a large online presence. We do a lot of Facebook Live where we sell singles. So, and we're going to email all our customers, every couple days. I don't want to overdo them with emails, but every couple days on new products. So if they are interested in something, they can reserve it, they can come down and get it, or we can ship it out in a second for them.
All right, I want to bring in some of our viewer questions that they're posting for Jim and John on Facebook. Samson wants to know, what about toys? How do you handle toys?
Toys are easy to handle. So we have the inventory, and if a customer doesn't know what they want, we ask them for the age group they're looking for, and we have a table, we display the products. They're about 6 to 8 feet away, and then they can tell us which one they want when they come to the store. It's a curbside pickup. No one is allowed in the store. So we will do like a catalog showroom where they can point at the product or let us know what they're looking for.
All right, Craig wants to know, these expenses for operating under these conditions and requirements, how will you deal with these expenses? And that's similar to Mark's question too, which is, do you expect enough people will be out shopping to offset the expenses of reopening? And, basically, do you gentlemen think it will be worth it? Jim?
Well, that's the million-dollar question. I think people do want to get out of the house, and then people are also worried as well. So they can continue to, buy online from us, and trust that's a safe way for them to get what they want. It's just going to be an interesting thing to see what happens. We do get people knocking on the door. I mean, I'm here all day, doing eBay and shipping and things. So I do get people knocking on the door, and we keep telling them, hey, send us an email. We'll deal with you, via email. I can't let customers in the store, and that's been working so far. I hope that the numbers come back the way they were. It's going to be difficult. It will be, but there's not going to be costs passed on to the customers and my collectors, because what we're having to do for safety is really not that expensive. I don't think anything has to be passed over to them
Right.
for that.
Look, it sounds like you're both trying to minimize the risk, but I want to bring in Dr. Patel because, you know, no matter how careful you are, when you start to reopen, there is a degree of risk. It's all about mitigation, but there is a greater degree of risk. What are the public health officers looking at right now that makes them comfortable to say, hey, the Bay Area, we can now move into phase 2 this coming Monday? Tell me about those numbers.
Well, Kristen, those numbers are really based, they're county specific. And so what they're really looking at is there a downward trajectory of cases over the last 2 weeks? Are there no deaths over the last 2 weeks? Is there sufficient protection for essential workers, hospital capacity, testing capacity, all these metrics? And so the Bay Area is in a good place for certain counties to start looking into this. But one other question I wanted to ask both of the business owners is there's talk of a lot of different businesses doing some form of a customer registry just in the event they need to do contact tracing. And I'm curious if either business owner with these two shops are thinking about doing that to keep the customer's potential name and phone number on file for a certain amount of time if they have to refer back and say, hey, there was an exposure, because adequate contact tracing is a really important part of reopening businesses and schools.
That's a great point and a great question, which I'm going to pose to Jim and John, which is Dr. Patel pointed out contact tracing is a critical part of ensuring that we can open up safely. So are you considering a customer registry perhaps so that you know who your customers are? Should there be an outbreak or somebody who gets sick, you can contact that person or find out who they've associated with or dealt with, or maybe even, you know, take note of which employee handled the packing of this particular item, who handled this sale, so that there is that data and information should you need it for contact tracing. Guys?
With my wife and I being the only employees at the business, so it's easier for us to handle. And also with our customers charging on credit card, it's easy to trace who the customers are. And we're very careful, and the only contact we have is their credit card.
Okay, Jim, have you thought about that point?
Yes, and we're pretty much the same with John. There's only a few of us that are here in the store, so we'll know whom helps what collector. And again, everything's either on PayPal or credit card. So we're not going to be handling cash at the moment. So we should be able to figure out pretty much whom our customers and collectors are at the time they come in. I'm not too sure about asking everybody their information for keeping it for records like that. You might get a little backlash for it, but I think if we keep it the other way, we'll be fine.
All right. I was going to say, right now, are you gentlemen taking returns? I assume you cannot, right? Or can
No
you?
returns. We are not accepting any returns on any products right now.
Right. Jim?
Well, we haven't had that come up yet, but most of our product, once it's open, it cannot be returned anyway. We have a fairly extensive policy on returns. Obviously, if someone has if they had the wrong size, jacket, and they could come in and exchange it for another one, we might have to change that now and not allow it once something leaves the store. But we'll make sure that they know that before they walk out of the front of the store with their product.
All right. Jim Bernardini of Lefty Sports and John Kavranian, owner of Nuts for Candy. Thank you both so much. And Dr. Alok Patel, great information as always. We appreciate all of you for this conversation.
Thank you.
We're going to take a short break. Absolutely. We're going to take a short break on the air. Conversation continues on our live streams, Facebook Live, and the ABC7 News app. All right, gentlemen, I think we can ask one more question, which is I want to know if you think, John, I know you're kind of part of a chamber that involves all the stores on Broadway and Burlingame, and that's hundreds of businesses. Is it your sense that many of you won't survive? And if so, what is the percentage?
There's a high probability that some of the restaurants won't survive. I believe the retailers will. The concern also is some of the exercise locations like Pilates, they're going to be struggling because I'm not sure if this mandate allows them to open phase 2.
That's right. The restaurants, dine-in, that's not a part of it right now for a lot of the local counties, even though, you know, in the state you're seeing some of that, more of that activity in rural counties. Have you talked to your counterparts, business owner friends in some of the counties that have already reopened a little sooner, like Shasta, Placer County, to see how things are going for them?
No, I haven't.
Okay. Yeah, Jim, I got to tell you, it breaks my heart that we can't have those signings right now. I know you often bring in athletes, you know, baseball players, Giants, Warriors, and 49ers, and kids love that. And all that is, we don't know when that's going to resume.
But we might have a new idea to circumvent the meeting of the athlete, where we can do it on a Zoom. And, you know, the athlete can sign the item and say, okay, oh, this one's for Kristen here, enjoy this item, or this is for John, or this is for Linda. And they'll sign it and say your name as they sign it. That's what I might want to try and see if it works. It might not be as personal as meeting the athlete as you used to do with your boy. But we'll see it. We'll try it and see if that works. Maybe it'll be something that works out for everybody.
Yeah, that's a great idea. You guys have to think outside of the box right now.
Absolutely.
All right, Jim and John, thank you so very much. Take good care, and I'll see you soon.
4, 3.
Welcome back. Thanks so much for joining us today on this interactive show, Getting Answers. A quick recap. The big story today, of course, San Francisco Mayor London Breed saying 95% of the city's retail businesses will be able to reopen for curbside pickup and delivery on Monday. Shopping malls will remain closed. And we've confirmed that San Mateo County will also be on board with this plan moving into phase 2. We've reached out to the other 4 counties in the Bay Area, Alameda, Contra Costa, Marin, and Santa Clara, to see if they're part of this. We'll let you know when they confirm, but usually they move in unison. We'll be back here on air at 3 o'clock tomorrow on Facebook, live stream, and on air. Thanks for joining us.
We are clear.
All right, thank you, Facebook friends. Thanks for joining us today. See you tomorrow.